The intention of this standard is to ensure clinicians are competent to safely prescribe, dispense and administer appropriate medicines and to monitor medicine use. To ensure consumers are informed about medicines and understand their individual medicine needs and risks. The standard has 4 criteria: clinical governance and quality improvement to support medication management, documentation of patient information, continuity of medication management, and medication management processes. There are 15 actions or activities that our service must have in place to meet this standard. Let's look at some questions that the assessors may ask to determine if we are meeting this standard. How does your service ensure appropriate governance of medication management? How does it develop and implement policies and procedures in relation to medication management?
We have a medication safety committee that meets regularly, and you can see minutes of that meeting. At that meeting, medication-related policies are developed and also reviewed.
How does your service monitor and improve your medication management systems? How are consumers involved?
We audit compliance with our medication management systems, and these audits are reported at the Medication Safety Committee. Risk assessment informs our action plans and policy changes. Any change in policy is disseminated through our service via established communication channels, such as service managers, NUMs and team leaders. They record that staff have read and understood the changed policy.
We have a Consumer and Carer Consultation Committee, and they review and make comment on all policies and medication-related information that we develop. The Yes survey also provides us with feedback on staff discussions with consumers about medication and its effects.
How does the service ensure that only clinicians with relevant authority can prescribe, dispense or administer medications?
We have policy documents that outline the scope of practice of clinical staff. Our job descriptions also detail staff scope of practice. We have a list of staff who have the authority to prescribe certain medications, and variation to this is considered at our medication safety meeting.
What processes does your service have in place to obtain and record a best possible medication history?
The need for a best possible medication history is outlined in our medication policy, and this is usually managed by our doctors during the admission process.
We have a policy on medication reconciliation. We also undertake an audit comparing the best possible medication history and current prescribed medication.
How does your service ensure the consumer's history of allergies and adverse drug reactions are documented?
Our policies clearly reflect the need for the identification of allergies and adverse drug reactions on admission to the service. This is flagged within the electronic medical record to alert staff to the issue.
If there is an adverse drug reaction, this is viewed as an incident that should be reported via the IMS+. These types of incidents are reported to the Medication Safety Committee and appropriate action taken.
What systems are in place to ensure that medications are reviewed, and the consumer is given information about their medication?
As the pharmacist, I or a colleague from the pharmacy department review all medication charts on a weekly basis. We audit these reviews to ensure that every chart has been checked. We make sure that on discharge the consumer is given a list of their medication, and with appropriate consent this is shared with their general practitioner or community pharmacist.
How does your service ensure that medication-related information is up to date and available to clinicians?
Staff can gain access to up-to-date medication information and decision support tools via our intranet. Intranet access is explained during orientation and reinforced during staff in-service sessions.
How does your service ensure that medications are safely stored, particularly those that are temperature sensitive?
We have policies around the safe storage of medicine. We review the storage of S8 drugs and report incidents in relation to S8 counts. We regularly monitor the temperature of refrigerators where medication is stored. These temperature checks are audited. We also monitor incident reports around medication storage and disposal.
What processes are in place to identify and manage medications that are high risk?
The Medication Safety Committee oversees our management of high-risk drugs. Minutes of this meeting will show where the use of drugs like these are discussed.
The assessors will ask you questions about medication management, how you gain access to the policies and procedures that guide your practice, the training you have received about medication management, and how we work to improve our systems to ensure the safe use of medicines in our service. What other evidence could your service provide to meet this standard?